Hello, everyone. A very warm good afternoon to all of you. This is Vaishali Vaishnav, founder of MTM Multitasking Mommies community, welcoming you all today for a special expert session. Yes, a very special expert session because we are addressing COVID related concerns of parents today with our specialists from UNICEF, Dr. Narayan Gaonkar, and consultant pediatrician and neonatologist Dr. Chetan Trivedi. Before we have our guest and our experts here with us, I would like to share with you what session today it is all about and what we are going to discuss. Today's session is need of the hour. So first of all, let me welcome you all who are joining, all the mommies and all our viewers today. Yes, indeed, a much needed session. How are you all? Good afternoon, and thank you so much for joining. Thank you for spreading the word so that we can take this session to more and more parents because, as discussed, it is need of the hour. So, without wasting your time, let me welcome our experts as we already have a lot of questions ready with us. So, let me welcome our experts of the day. Good afternoon, sir. A very, very warm welcome to both of you.
Good afternoon.
Thank you. Good afternoon. Thank
So,
you very much for
first of
having us
all,
in the show.
thank you. Thank you so much, sir. First of all, I would like to introduce Dr. Narayan Gaonkar. He's senior public health expert and currently working as health specialist in UNICEF Gujarat, India, focusing on maternal, newborn, child, and adolescent health. We have Dr. Chetan Trivedi with us. He's a practicing pediatrician at Neha Children Hospital, Kakaria, since last 23 years, infectious disease consultant and vaccine expert. He holds many positions at various pediatric associations. So we have such experienced and learned experts today. So I had received a lot many questions from our mommies, uh, and we'll be taking some live questions as well. So all our audience can also ask the questions in the comments, and we'll take up that with the experts. First of all, to start with, uh, I would like to, ask Dr. Narayan Gaonkar, sir, that, sir, the kind of, things which are going around, like a third wave is being predicted, which is, all are telling that it is going to affect children a lot. Because as compared to the first wave, there had been, more children being affected in the second wave. So now for third wave, it is being predicted and all parents are like almost scared and have no clue how to go ahead with it. So sir, please tell us what is the current situation of COVID in children and how we should be prepared for it.
Thank you very much, Vaishali Ben. It's a really nice to talking to our people. I'm privileged to be with you and Dr. Chetan Trivedi today. Good afternoon, everyone. Actually, from UNICEF, we would like to promote early childhood development for every child everywhere, and we are actually kind of promoting a framework called Nurturing Care Framework, where every child is given good health, good nutrition, responsive parenting, safety and security, and also children are are getting opportunity for the early childhood learning before they get into formal schools. This is what we wanted for children. Unfortunately, this COVID has disrupted many people's plan, including parents. But my message today to parents is, we should be mindful and aware of what is really happening in the world and in India. At the same time, don't get panic. I'll tell you why. In India, if you look at all the data, from first wave and second wave, we have less than 12% of all confirmed cases, happened in less than 20 years of age. That means more number of cases happen in elderly and comorbid conditions. And even if you see, the deaths were very small, less than 2% of all the deaths. But let me tell you, below 20 years of age, the population size is 41%. This 41% contributed less than 12% infections, less than 2% mortality in the COVID story. So in the first wave, fortunately, children were not much affected. We are thankful. But in the second wave, we started seeing some cases among children in some districts, some pockets. But they were also less than, they were in the range of 10 to 25%. I'm taking the age of below 20. And children, actually, if you see now what's going to happen now onwards, children are as susceptible as adults who are not vaccinated. Many of the parents and adults got vaccinated, but children community, we have not have any opportunity to vaccinate them. But the good part is the COVID in children is likely to be a asymptomatic infection. Small percent of children who may require medical attention. We'll hear more from Dr. Trivedi, who is with us today. Newborns and children who are having comorbid conditions, maybe cancer, maybe autoimmune disease, they may have little bit severe or moderate illness, but we need not to be worried. Again, I'll tell you, whether the third wave will come or not come will depends on at least 4 factors to my mind. This is actually COVID vaccination coverage in the area, a compliance to COVID appropriate behavior like wearing the mask, sanitization, and virus mutation. We have multivariant strains, noticed. So if the mutation fast, more risk. And the last thing is COVID waves in other parts of the world and other parts of the country. These are going to decide actually whether the third wave will come, or actually the basic question is not third wave will come, when it will be. Of course, the magnitude can be vary depending on these 4 factors I mentioned. So, but you need not to worry again. You know why? Gujarat is a good state and you are having a good infrastructure, and we work closely with the government and also partners like Indian Academy of Pediatrics, IMA. So the information I have, to my mind, there are 3 strategies. We are working very closely with the government and partner. First and foremost is preventive strategy. Second is early forecasting and alertness system we have put in place, working with the government. Basically, it is led by the government with the support of the partners. And the third thing is preparation for dealing with the extra cases, if at all they come. So there is a system in place. There are details, I can share you maybe later in the show, what all measures we have placed. But these are the 3 big strategies we have put in place. And we have colleagues like Chetan Bhai and a big team of Indian Academy Pediatrics. So parents, don't be panicked. All COVID appropriate behaviors to keep your children safe. I can explain in detail all these steps in detail maybe later. Let's listen to maybe Chetan Bhai before I go into the details. Over to you.
Yes, a very warm welcome to Dr. Chetan, sir.
Yeah, thank you so much.
Yeah, sir. So now next question to you is that how can we protect our children from the COVID infection in future?
Yes,
Mothers always have those typical questions like, can we give some immunity boosters, or can we give some supplements to our kids? How can we protect them from this expected third wave?
Yeah, first of all, thank you, Vaishali Ben and UNICEF for being, making me part of this interactive program. And it's a really need of an hour, because public awareness is more important rather than anything else, because there is so much of panic. When you say third wave, every third patient is asking me, sir, third wave aayega, kab aayega? So I said, it is not just prediction, it is speculations. यूजुअली अभी धारणाओं थी रही, मतलब ऐसा लोग मानते हैं कि थर्ड वेव आएगा उसका कोई गारंटी नहीं है, और आएगा तो कितना सीवियर आएगा और कहीं कब आएगा वो पता नहीं है. बट यस, इट इज ऑलवेज बेटर टू बी प्रिपेयर्ड फॉर वर्स्ट थिंग. सी इट इज, क्योंकि हमने देखा कि सेकेंड वेव it came just like surprise to everyone, because we relaxed a lot during November, December, January, February, and March. We had the real bad time from March, April, and May. So now everybody has burnt their fingers. So now nobody, including the government or all their partners, or as a relatives or as a citizen, we don't want to see this wave again. But एक बात है कि जो पैंडेमिक है वो उसका पैटर्न होता है कि एक वेव आएगा जाएगा, दूसरा आएगा, तीसरा धीरे 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 करके जाएगा. सो वी एक्सपेक्ट कि भाई वेव तो आएगा, अब कितना वेव सीवियर होता है उसका डिपेंडेंट है व्हाट डॉक्टर नारायण सेड, ऑल फैक्टर्स. अगर हम हमारे हाथ में जो भी है, व्हाट एवर थिंग्स वी कैन डू इट, वी हैव टू डू इट टू प्रिवेंट अकरिंग द मिसहैप ऑफ दिस थर्ड वेव, राइट? इफ एट ऑल इट कम्स, हमको સપોઝ આપણે કહીએ છીએ કે વાવાઝોડું આવે તો વી હેવ ટુ પ્રોટેક્ટ અવરસેલ્વ્સ. વી કાન્ટ સ્ટોપ ધ વાવાઝોડું, રાઈટ? that we cannot stop it, but at least we can save ourselves. Now the question, your question comes, how to protect our children from so-called third wave, if at all it comes. Now see, for anyone else, any adult, we need a COVID appropriate behavior so that we cannot get the infection from others. Second thing is we should get vaccinated because now we have the weapon in our hand. So we have to utilize it fully. So there are people who have not been vaccinated yet. Please go and get vaccinated as early as possible without going into much detail which vaccine is better, which is not better. Go get it. That is the only way you can save yourself. Now, children, we don't have the vaccination. So we have to depend upon the adults who are getting protection by the way of vaccination. So we should get vaccinated. Those who are going to come in contact with children, that is first thing. Yeah. Now children will learn what we are doing. So if you wear mask, if you do social distancing, if you sanitize yourself, children are going to follow it. So if you make a party, then naturally children will also like to go to party. So it's, charity begins from yourselves. So we have to stop doing it. We should not go into the area where it is crowded, people are in a crowded situation. We have to keep our guards on always. So that is the second thing. And the last important thing is what you can give. This is every parent is asking me, sir, can I give something which can protect my child from the COVID infection? See, there are so many things in a WhatsApp university is going on, but mind well, there is nothing as such which is a really immunity booster which can really protect the infection. So what is most important is the barrier protection. You just wear the mask. Simple thing, it is aerosol which is going to come. So if you wear the mask, it is not going to enter. If you wash your hands frequently, it is not going to. You don't touch your face, it will not. It is not going to go inside your body. So it is very simple as that. And if you suppose people are telling zinc આપીએ, વિટામિન સી ની ગોળી રોજ આપું છું હું મારી ડોટર ને કે મારા સન ને, આપણે વિટામિન ડી આપી દઈએ. See, vitamin C, it is fully available in our all citrus fruits. So don't go for medicines because there are chances you are going to overdose your child. So limonu sharbat pidao, narangi mosami ras pidao, orange juices. These are the full of vitamin C and vitamin D. People are craving for vitamin D capsules and all that sachet. Not needed. Go in sun. સવારના 10 થી બપોરના 3, if you go and ask your child to play for 10 minutes, they will get at least 3 to 4,000 international units of vitamin D. So that is sufficient. Even twice or thrice a week also, if they go on a terrace and get some sunlight, that's enough. So don't go for any immunity booster. Even people are asking for NAS, that the inhalation sort of what you are telling. So that is also not required. You don't overdo the things, right? So this is what all about how to prevent our, protect our children.
So I think the gist which comes out from both of the experts, they just discussed that COVID appropriate behavior is the best thing which will avoid and which is going to protect us from maybe the third wave, if at all it is coming. If we talk about mask, we had a couple of questions related to it from moms. Like one of the moms of a toddler said that what is the appropriate age to make a child wear a mask? And then there was a question that which mask should we make our child wear? Because N95, they were feeling it too suffocated, maybe so a 2-ply cotton mask. So these are the concerns of the mother. So I would like to ask our experts this question about mask.
I think for mask, the N95 mask is not required for routine use, that we all know. first thing is we can very well use the cloth mask, and that also if we are very much sure, we can use a triple layer mask. And particularly where we are going, that is important. Suppose if you are going to the hospital to show somebody for consultation, you know that there will be patients waiting in the waiting room. There you go for with N95 mask. So that is very simple. And when you go out in the open ground, you can wear the cloth mask. Now, as far as the age after which you should allow your child to wear the mask, earliest, ideally less than 2 years, we should not ask the child to wear the mask, because they are not able to manage the mask, because sometimes they may smother, or sometimes they try to remove it and they can entangle their neck. So that can be the problem. So less than 2 years, even WHO or CDC, they don't advise. But 2 to 5, there is discrepancy. The WHO says it 5 years and other CDC says 2 years. But I think if the child is having that understanding how to manage the mask properly, you can allow them to wear the mask. In my OPD, even a 1 year, 1.5 year child, they wear the mask very beautifully. Yeah, it is not advised, but still, say they can manage. Now the children, they are grown-ups looking at us wearing the mask only. So hardly they have seen us the bare-faced. So they are able to manage, but ideally 2 years and above, we can allow them to use, particularly when you are going to the places where there are more chances of this thing, infection. So that is about the mask.
Can I just add one point?
Yes, please.
Yeah, I know which mask is important question, but wearing mask correctly and consistently is equally important. And children unfortunately do not have large number of options to choose from. But we need to put some pressure on the market now to make age appropriate masks. And because adults have a lot of options. For the parents, I would like to recommend. You can wear if you do not have a N95 mask, you can also wear a surgical mask first, which is disposable, and then a cotton mask. So 2-layer mask gives you enhanced protection when you are going for the shopping, when you're going for the work. It will be as good as your N95 mask, close to N95 mask. So, and it can be reused, the cotton mask. But the first mask should be a surgical mask, followed by which you on the top you wear a cotton mask, which can be reused. Please don't remove the mask, at any circumstances. So that's why we actually strongly recommend people visiting, eateries, eating food outside. You don't go for birthday parties, because you need to bring the mask down, and then the virus enters. And virus is not like a cat or a dog. You can see, we breathe almost 20 times a minute. Virus do not take much time. So you lowering the mask, you are actually lowering your guard. So correct use, consistent use is equally important as much as which mask you use.
Right, absolutely right, sir. Sir, we have our moms asking couple of questions in the live session. One of our moms, Vandana, is asking that kids need to play outside. How risky is it for them, and as far as the COVID is concerned?
Yeah, Narayan. See,
children. Children above 10 years have almost same level of risk like adults. So basically, the risk of COVID depends on multiple factors. One is we call risk equation. Risk is directly proportional to exposure, vulnerability, and impact, and indirectly proportionate to the capacity. Let me explain. If the child is not wearing the mask, but in playing like a group play, and children are screaming, he will have a exposure. If there is any child who is positive there is a high risk of getting the infection. So it is wearing the mask correctly will be important. One. Second, children should be encouraged. Even the parents can play with the children if there is a space permits. But many children we notice outside, they are screaming, but their mask is on the chin. It is not actually covering the nose and the mouth. So that will increase the risk. Fortunately, the cases are going down, but we are not saying COVID has gone. The cases may be still around. But if there is any case in the nearby place, the children will have continue to have a risk. So couple of days, it's asked, it is better to reduce the outdoor activity. If at all you are doing, it can be with the parents or known one, not too much a big crowd. If there's a crowd, then the mask is required. And hand washing frequently when they come inside home, They should make sure they know they put their clothes and directly go to the bath and sanitize their hand and without touching things in the house, touching their books and pens and other things. So sanitization when they come inside the home after the play is also equally important. Chetan bhai, over to you.
Yeah, correct. Fully, very well answered. Absolutely nothing left out. We can go ahead for next question.
Related to that, we have one more mother asking that is it advisable for children to go for sports coaching classes in closed areas?
That's again a risky behavior because that's why we are not opening up the schools now. So that's the issue because in a closed atmosphere, we are having more chances of viral transmission. So if it is must, then we should stand. Rather, outdoor activity is preferable with proper masking. So closed space, because all this closed space they are with AC. So there will be more problem because that same recirculation of the air. So if at all some person is infected, then it will be recirculated, and that's going to be an issue. Dr. Narayan, anything else?
Yeah, see, there are some risks we can avoid, some we cannot avoid. If you cannot avoid the risk, if you have to go, then make sure you take all preventive measures like mask, sanitizer, distance. At the same time, don't be shy to tell people who are not following this COVID appropriate behavior to follow.
Yes.
It's actually a matter of a respect. If they wear mask correctly, it's matter of respect to the people around. So it doesn't say that they have an immune power or they are young, nothing will happen. This all nonsense. It will not work. So I request you step out only when required. If you can minimize the risk, is very good. If you can't, but practice for yourself and also people in and around in the class or in surrounding area. If you can politely advocate, it will be nice. Don't catch a fights, but politely advocate for them to also follow all COVID appropriate behavior.
Right, absolutely. So Vandana, Gitanjali, Riddhi, all moms who were asking about is it okay for kids to go and play outside? It is okay, but just like sir said that it is very much important that they wear a mask and avoid making them play in a closed area and make sure that they wear the mask continuously. One of our viewer is asking that a lot of teachers are calling toddlers home with 5 to 6 children in a batch for studies or for activity. Is it advisable to send? Again, the similar kind of questions are coming up. Yeah.
Answer is also same. If it is compulsory for you to send, then you can send it, but with all proper precautions. You have to be very vigilant in masking.
Yes. So there is one more thing. We have heard that kids should not wear mask while playing as they tend to inhale carbon dioxide because they breathe from mouth. Is it true?
Yeah, if some kids may have that issue, but it is just a smothering or maybe because it has been tightly fit that can cause breath. Narayan wanted to make a point.
Yeah, actually, when people go for exercise like jogging, running, and a heavy exercise where oxygen demand goes up, people say, a mask will reduce the oxygen intake. But before you get into such place, you should make sure whether the place is safe and where you can take down your mask. If the place is not safe, probably you should not go for jogging and walking over there. But if you are in a beach side or you are in a garden where nobody is there, they can take out the mask. But make sure people are crossing, running, then your defense goes down. So we should be calculating the risk. You cannot be blindly following something without assessing the risk level in that given point of time. Exercise is important, daily activities are important, but where will you do these activities is also important. And I also see a lot of children, play area, volleyball, cricket matches they're playing, and they wear masks, but they come down and all the bottles are kept in one place where they open up the mask and they drink water interval time. It's high risk behavior. They should keep the bottle in different places. They should not be opening up all the masks at one go. So these are some practices which we can minimize the risk. I'm not saying you can completely avoid the risk, but this can minimize the risk.
And sir, somebody is asking that what is the time to change mask? Can we wash and reuse it? I think we should, if we have
N95 mask.
Yes, sir.
See, N95 mask is one-time use, but people, it depends on how long you use it. There are people who actually, if they just go for the getting a milk packet or something, they just keep a dry, they hang it in a dry place. They use it for a couple of hours. But total cumulative use should not be more than 8 hours or 10 hours. But if people like healthcare workers, doctors, if they wear in the morning, they come back in the evening, people dispose it off. No second use of N95 mask and the surgical mask. But that cotton mask, you can wash with the soap and detergents. You can dry and use. And when you use a tube mask, like the first inside surgical mask usually goes for disposal, and outer the cotton mask you can wash and reuse.
Absolutely. One of our moms, Hina, is asking that we have heard that now the virus is airborne, it's in the air, and that's why it is affected very easily to anyone. So is this true?
See, virus was airborne since beginning. Initially, we were saying that it was a very big particles, big droplets only getting infected. Now airborne, aerosolized. So that's why we are telling that we have to keep a distance of 6 feet or even more, 2 to 3 meters distance. But so that's why the best thing is to avoid that close proximity. And second thing is masking. So barrier, we have to keep it. That only will save you, because virus is going to be airborne only, because that goes to the nose and the respiratory tract and that gets infected. And we have the receptors where that will catch the virus in the respiratory tract only. So that's why it is going from there only. So it is definitely airborne. We need to take care.
Yes, sir. Yes, Narayan, sir.
Yeah, I just want to add, it's predominantly actually droplet infection, but these droplets they take time. From the beginning of the COVID infection, we were telling people to do gaj ki duri, and and also it takes some time. We are telling from beginning, it takes time to settle down the droplets, and the micro droplets take longer time. So imagine if somebody is in a room, conference room or meeting room, they come out, you go in. And if that area is infected, the droplet may be there, person can get infected. Second common place is a lift. People go in, if somebody sneezes, coughs, the droplets are still flying over there, they have not settled, and somebody goes in again without a mask, they can get inside. But it doesn't mean that everywhere in the air virus is there. This may not be true, but it depends on the prevalence of COVID cases in that surrounding. So what we just suggest, even if nobody is in the lift, you need not to bring down the mask. And if you're in an office space also, you don't know who crossed how many times. So it's good to keep a mask on. I also many mothers and many of you who are listening also working. So at workplace, please remember at lunch table, you are not going to sit in one table and share the lunch. Many people in Gujarat, I know, they are fond of sharing their tiffin boxes with friends and colleagues. But you please try to keep a distance, because when you lower the mask, your guard is down. Please be careful.
True, sir. Absolutely true. Now, over to, if we go next towards vaccine thing. Sir, when are the vaccines for COVID for kids expected in our state and our country?
See, as we know that any vaccine which has been coming into the market, first they will be studied on the adults, right? Healthy adults. And then gradually they will lower the age and then they will study it. So first it was for more than 18 years, particularly whatever the brands available in our country. Now out of those two brands, Covaxin and Covishield, now Covaxin, the studies have started for the children, they 6 months to say 2 years to 18 years. So what they have first done is, first they have taken a group of 12 to 18 years, they have started studying, giving them, then they will look for the side effects, and then what is the immunogenicity, what is the antibody level, and then the result will come. So I think minimum, the way we are having a 3-4 companies all over world which are doing this trials. We know that mRNA vaccine, whatever the Pfizer and Moderna, they are been allowed to give 12 years and above, but they are not available. For our country, I think Covaxin, which is having a undergoing trials. So usually the trials will take 3 months or so minimum. So it depends on the government wish it will come, but at least 3 months it will be there down the line. Second thing, there is another vaccine which has not been in market, that Zydus vaccine, that also the pediatric trial is also already on. And we have heard just the Novavax also, now new vaccine. They are also been studied in a pediatric population. But as of now, if we see 3-4 months down the line, we are not expecting the vaccine for the children to come. That is for sure.
Right. And sir, any other alternate vaccines of like flu and any other shots which are advisable for kids just for the prevention sake?
Yeah, there is now some misunderstanding and some messages which are going on wrong way, I must say, because the people are telling that there is some universal vaccine or some universal shot for flu shot that will prevent the COVID. No, what we are getting vaccine is for flu, influenza. For that, we are getting the vaccine, and that is an annual vaccine. Every year, we are getting the flu shot. For less than 9 years, we are giving first time 2 doses, then every year single dose, and more than 9 years, single dose we are giving for that children. That is for flu, influenza prevention. Yes, it is important disease because that is also again behaving just like COVID. The child usually presents with the fever, cough, cold, shortness of breath, or the body ache and all that. So there will be confusion whether it is the COVID or influenza. So we don't want any of the respiratory tract infection to occur. And for as far as the children is concerned, we don't have the vaccine for COVID, but we have established vaccine for flu or influenza. And we know that influenza is more causing deaths in the children as compared to COVID. And second thing is COVID infection, usually it is asymptomatic in children or mildly symptomatic, but flu is not. Flu is having a very good symptoms and severe symptoms also. So we need to protect ourselves from influenza. And there's another vaccine which is called pneumococcal vaccine. People get confused with that. See, influenza is virus which is causing influenza, and we have a flu vaccine for that. That is annual vaccination. And pneumonia, it has been caused by a different organism, that is pneumococcal organism. And for that matter, we have a vaccine which is available in private sector, and it has to be given less than 2 years, 3+1 schedule. So that is for pneumococcal pneumonia. We have H influenza also. That also we are giving in hospital. That is a government setup. That is Hib pneumonia. So we have specific vaccine for specific disease. But there is no other vaccine which will give the cross protection against the COVID. So we can't say we will give a flu shot and we'll get a protection against COVID. So that is to be very clear. They are needed vaccine, but not for COVID.
Right.
Yeah, I just want to add one thing. To keep children safe from COVID, we strongly recommend parents and family members should get vaccinated. Vaccine is available for them. So if the family members all get vaccinated, the risk of getting infection home is much, much lesser. So if any of our audience still not got fully vaccinated with 2 doses, please book your appointment today. And and if you are due for your vaccine after some time, please go on the due date. But do take 2 vaccines. It will reduce the severity of the disease, reduce the risk of admission in the hospital, reduce subsequent spread of the disease, in the surrounding and in the community. Please don't hesitate and go for it and get protected yourself. Okay.
Yes, absolutely, sir. And in fact, our members who were facing issues in booking their slots for vaccination, we had almost started a kind of helpline where, we get their slots booked for vaccination. So we still do that for them so that they don't face any issue for getting vaccinated. We have one of our moms asking, what is recommended gap to take vaccine after getting recovered from COVID?
See, this is for you are asking for children or COVID or adults. See, I'll talk both the issues. See, adults, if they have got a COVID infection, they have recovered, and if they have not taken the COVID vaccine, then they at least 3 months from recovery they can take. After 3 months of recovery, they should take either the remaining dose, or you can get a fresh dose of 2 doses. Now, if your children have got COVID infection and your regular vaccination is due, then at least 15 days after recovery, you can get all your regular vaccination shot to your children. So that is also very important. We are just looking at COVID, but we should not undermine the other the diseases for which vaccination is available. Because if you miss your measles, if you miss your typhoid, if you miss your hepatitis, then that disease can occur, and ultimately any disease will cause less of immunity, and ultimately they will make you to go to the hospital. So we don't want to visit hospital. So just take the vaccination properly and save yourself, protect yourself.
Right. And sir, we had some questions related to pregnancy and breastfeeding mothers. Like, uh, can they take vaccine if a mother is if somebody is pregnant or if somebody is breastfeeding? Can they take vaccine? Is it safe for them to take vaccine?
See, we have government guidelines now. We have like two scenarios. One is the breastfeeding mother. Now we know that breastfeeding mother is going to be very close to that child, right? And we know that we can't give anything to protect the child. So yes, breastfeeding mother should take the COVID vaccine, because this all COVID vaccine, whatever available, they are not having a live virus. So it is not going to harm the mother, as well as it will not go from mother to the bodies to baby by breastfeeding. So that is second thing. And second thing is, if the mother have been given vaccination, they will make the antibody, and it is shown that the antibodies they transfer from mother to baby through the breast milk. So ultimately it will protect the child. So this is a good way of protection, indirect protection to your kid. So you get yourself vaccinated for breastfeeding mother. You can take the vaccinations very safely because the government is also approved. Now the question of pregnant lady. As of now, the government guidelines say no to the vaccination for pregnant lady. But I really wonder that there will be a recommendation will come soon that it should be allowed to the mothers also, because what happens during pregnancy, if the person gets, the lady gets COVID, then there are chances of some complications. So we would like to protect that mother from that complication. But let us wait till the government gives them clear guidelines. But breastfeeding mother can very well be given the vaccination for COVID.
Yes, right, absolutely. Thank you, sir, for differentiating for vaccination for pregnant as well as breastfeeding mothers. So we have several questions coming up now, and those are for the other kind of effects which we have, like screen time. Then we had one mother asking that her baby was born just before the lockdown last year, and now when she's 1 year old, she has not been able to socialize with other people, and because of that her milestones are being delayed. So in that case, what can be done, sir?
See, this is the real problem. We are looking at the COVID, but there are many, side effects of COVID-related issues. So this is one of them. Because of lockdown, the child is not been interacting. So social interaction is very, very important part as far as the development of the child is concerned. One is the speech. Second is child's cognitive development. So all development depends on the social interaction. For that matter, I think you have to continue talking to your child. So the parents should give enough time to the parents, the child. And that's very important. And as far as possible, because there are people who are giving, while feeding the baby, therefore 7-month, 8-month child is not taking the food. Then they will show something in the mobile and then they will try to give the food. So that should not be done, because ultimately less than 2 years, the screen time should not be allowed. So 0 hours or 0 minute of screen time, because ultimately it will affect the social development. And that's an issue. It's not that eye which is going to get damaged, but the social issue. So social development will be at home, at hamper. And that's why we should not allow them to use that gadgets or this thing. So I think what she needs is a proper counseling, maybe some development expert, and you have to interact with them socially more and more. Then I think child should come out. And we have to look out for the other reasons for delayed development also. We should not be just because of lockdown. There may be many reasons for delayed development. So she should take care of that and consult a proper development pediatrician.
Right, right. And sir, looking at last 1.5 years, our kids have been studying online continuously with a lot of screen time. So what would you like to say about it? કે કેટલો screen time જરૂરી છે, કેટલો હોવો જોઈએ? How much screen time should be there? And what care do we need to take so that it doesn't harm our children?
This is really a burning issue for all of us, including myself. Because I also have a daughter who she's always on either she's studying for the school na lectures હોય, એ પતે એટલે પછી કંઈક સ્કૂલ ટીવી જોવા બેસે, એ પતે એટલે કંઈક મોબાઈલ જુએ. Ultimately, see, what is your screen time? સ્ક્રીન ટાઈમ એટલે યુ આર ઇન ફ્રન્ટ ઓફ એની સ્ક્રીન. સપોઝ તમે એમ કહો કે તું આખો દિવસ મોબાઈલ ના જો, અને if she goes to watch the TV, then again it is screen. And suppose if she wants to relax after her lectures of the school, she will again go to see the mobile game. She will play mobile game. So we are shifting from one screen to another. Ultimately, it's a screen time. So by definition, by WHO recommendation, less than 2 years, મેં તમને કીધું પ્રમાણે 2 વર્ષથી નાના છોકરાઓને સ્ક્રીન ટાઈમ નોટ અલાઉડ, એક્સેપ્ટ કે તમારે કદાચ કોઈની જોડે વિડીયો કોલ કરાવવો હોય દાદા દાદી જોડે, કે એ પણ એક જરૂરી વસ્તુ છે કે તો બરાબર છે. બાકી નેવર એવર યુઝ ધેટ એઝ અ ડિસ્ટ્રેક્શન ઓર કામિંગ. સપોઝ અમારે ત્યાં વેક્સિનેશન પેશન્ટને આપીએ એટલે તરત મ્યુઝિક વગાડશે અથવા મોબાઈલ બતાવશે. સો દેટ શુડ નોટ બી ડન, બીકોઝ અલ્ટિમેટલી ડિસ્ટ્રેક્ટ કે કામ કરવા માટે પણ ના વાપરવું જોઈએ. બીજી વસ્તુ કે જ્યારે આ બચ્ચાઓ છે મોર દેન 2 years, વેન શુડ યુ ઇન્ટ્રોડ્યુસ ધ સ્ક્રીન? તો યુઝ્યુઅલી આફ્ટર 2 years you can introduce it, but 2 to 5 years maximum allowed screen time is 1 hour, not more than day in a day, 1 hour a day, એનાથી વધારે નહીં. અને મોસ્ટ ઓફ ટાઈમ યુ શુડ બી વિથ ધ ચાઇલ્ડ, કારણ કે એ લોકો જ્યારે જોતા હતા કો વ્યુઇંગ કહેવાય. યુ ટ્રાય ટુ સી એ લોકો શું જુએ છે અને કેવી રીતનું જુએ છે, કારણ કે there are so many aspects of that. ગ્રેજ્યુઅલી જે મોટા થાય છોકરાઓ, they will go for games, they will be violent behaviors, they can be concentration lapse, scholastic performanceમાં અફેક્ટ થશે, socially detached થઈ જાય છે because they will be always on the screen, so socially they are not. So issues of mental health, social health, physical health. What is physical health? Always તમે જ્યારે જુઓ ત્યારે સોફા પર બેસીને તમે ટીવી જોતા હોય અથવા બેસીને સ્ટડી કરતા હોય અથવા મોબાઈલ પર ટીવી જોતા હોય, મોબાઈલ જોતા હોય. So there is no activity. So what you need is the balancing of activity, screen and balancing activity. Activity માં શું આવે? First is your hobbies, your physical activities, your food. તમારું ખાવાનું, જમવાનો ટાઈમ, it should not be with the screen. Normally ટીવી સામે જોઈને બેસીને જમતા હોય છે, એ નહીં કરવાનું. That should be a family time. And most importantly, a sleep time. Minimum 8 to 9 hours of sound sleep is required. It's not that કે તમે સુઈ ગયા અને 2 કલાકે ઉઠ્યા, એવું નહીં. અને મોસ્ટ ઇમ્પોર્ટન્ટલી આપણા ઘરમાં ટેવ જ હોવી જોઈએ. If you tell your children to do something, they will not do. They will follow you. So રાત્રે સુતાના 1 કલાક પહેલા you have to stop the mobile screen because that blue light ultimately disturbs your sleep. So એ આપણે ખાસ કરવું પડે. So તમારા બાળકનો સ્લીપ ટાઈમ અફેક્ટ ના થવો જોઈએ, હોબીઝ ના અફેક્ટ થવી જોઈએ. સો આ બધી વસ્તુ છે જે ગ્રેજ્યુઅલી સમજાવતા રહેવા કે બાળકને, and then you can save. For adolescent, it is a problem because they are more with the mobiles. So what you can do, because we know we have to get them connected with us, give them feature phone. Don't give smartphone, because even we are addicted to it. Because if we have smartphone, કામની વસ્તુ જોવાની હશે તો પણ WhatsApp જોવાઈ જશે, social media જોવાઈ જશે. So that happens with the children. So these are the ways we can definitely try to restrict the screen time, side effects of screen time, and make them at least, healthy screening time should be there. There is healthy and unhealthy. So all things are very important. And one more point I would like to add, because આપણે છોકરાઓની વાત કરી, સ્કૂલના છોકરાઓની, look at it how they are studying. Because there is a posture which is very important when they are sitting. તમે જ્યારે બેસો છો ત્યારે તમારી આઈ લેવલ પર તમારું લેપટોપનું ઉપરનું ટોપ હોવું જોઈએ. યોર હેન્ડ શુડ બી સેમ, તમારા પગનું સરફેસની સેમ હોવું જોઈએ. અને તમારા જે થાઈસ છે, જે બેઠા છે, 90 ડિગ્રી હોવું જોઈએ. અને બેકને સપોર્ટ આપવાનો છે. ધીસ આર ધ પોસ્ચર ઇઝ વેરી ઇમ્પોર્ટન્ટ. અને મોબાઈલમાં હંમેશા યુ હેવ ટુ લુક એટ યોર આઈ શુડ ગો ડાઉન, આમ નહીં જોવાનું. So this is important. આપણે જ્યારે આ ડોકી. So these are the problems because prolonged this thing. So these are some things certain things we have to keep in mind.
Absolutely. Dr. Narayan was saying something.
Yeah, I fully endorse what Chetan bhai said. I just want to add, the screen time can be also divided, kind of, how much are kind of really essential one, which are one non so essential. Like, we don't really have a choice to say no to classes, online classes. They should continue. But we do have to choose if a remaining time, how much you will allow the child. It will be kind of a negotiation. So to negotiate this additional time, we need to also think of a substitute for these online games. Extra viewing, extra TV. So we also recommend those who have young children at home. Please try to become their friends. And spend time with them. Even the young babies, for the early childhood development, the children require only three things. Their demands are very simple. They need something to eat, they need something to play, and they need a love of parents and the loved one, maybe other members of a family. This is what is required to them. So it is smart if multitasking mommies. I have one request. Before you step out of the house, try to give some calendar of activities for the child. There are lot of activity, drawing, reading, homework, but give them a small task and you tell them, please do this drawing today. Okay, they will do. They will spend 1 hour on that maybe. Okay, try to find a substitute. And also try to engage a senior. If there is any elder sibling is there, they can also monitor the child, younger one, what they are doing, and together they can play, encourage play. So these things, and I also request you. We are all busy and lot of stress, on parents, because some people lost job, some people have to work extra. All my colleagues, doctors, nurses, extra working. But we need to keep a mindful, that keeping it positive during COVID-19. We should mind what we speak. Use positive words, telling your child, simple thing like, you can please put your clothes in a laundry bag. You can say that, but many people say, don't mess around, don't mess it. So they get angry, they get upset, they go take the mobile and run away into their rooms. They're not liking me. So it's also kind of keeping it positive, not to shout at them, talk to them politely, and to help the teens. Just to spend some time with them, talking to them, solving their problems, answering to their questions. COVID has created a lot of questions in the adults. Quite obvious that children will have also questions. So we need to answer to them, and then be honest, tell them what's happening. No need to hide anything. Be supportive. It's okay. We may not have all the answers. Even I don't know all the answers to the COVID problem. It's okay to tell them honestly. This is what we know. This is to be done. This is not to be done. So, and support them. That will help them. Otherwise, just saying don't play game is not going to help.
True, very much true. Engaging children in these kind of activities is very much important to avoid the adversities of screen time, which is happening. Sir, we had one last question. Yes, sir.
One point in the screen point I just forgot to mention that when the kids are, particularly school kids, we know that આપણા બધા સ્કૂલમાં અત્યારે ઓનલાઈન લર્નિંગ કરે છે તો આઈઝ ને સ્ટ્રેન ઓછું પડે એના માટે so there is a rule of 20-20-20 if you are aware કે આપણે suppose 20 minutes સુધી તમે સ્ક્રીન સામે જુઓ છો then you take a break for 20 seconds and look for the object which is 20 feet away from you. So that will cause accommodation of the eyes. કેવી વસ્તુ છે કે તમે કોન્સ્ટન્ટલી સ્ક્રીન સામે તમે કદાચ ખબર હોય તો આપણે લોંગ પિક્ચર જોઈને બહાર નીકળીએ 4 કલાક તો you get headache. Why? Because તમે constantly concentrate કર્યું, so your eye is not blinking as per the requirement. Because eye blinking એટલા માટે જરૂર છે કારણ કે અંદર ત્યાં moisture જોઈએ છે. So you constantly look at like this, then there is less frequent blinking and that will cause a headache. So you have to just relax, do accommodation, and then so these things to be taught to the children who are they have to sit on the net or computer for long hours, for at least 4 hours, 5 hours. So these things are important. Just I wanted to add that.
True. Sir, one of our moms of a youngster, like around 18-year-old child's mother, she had a query that because of the fake messages on WhatsApp and that, it is being, these young people are being affected mentally a lot because of so many fake messages and other messages, and then peer pressure, they talk to each other and this is happening, that is happening, and because of that they are not able to focus on the productive activities which they should be doing. So sir, in that case, what can be done?
Yes, Narayan, you would like to answer or should I? See,
go ahead, I will add.
Yeah. See, adolescent age group is really a troublesome age group because they are almost miniature adults. We know that. So we should understand them better because now we know what we are suffering from, we are going through. Because because there are, vaccines are been, the real savior. We all know because first year when the COVID came, everybody was shouting, let the vaccine come, when the vaccine will come, vaccine. So we know that it is needed, but there are people who are against the vaccination. So they will be giving certain videos, and always the negative videos they impact or rather attract us more. So there is a human tendency. If I tell you that you do one thing, you will not do it. But if I say you don't do this, you are going to do it. So that is a
Right.
human nature. So we have to be, train them. Then there are news which are usually news to make market the things. It's not the fact. So try to find out the fact and rather don't get carried away with that. Whatever news is coming, always look at with a suspicion. Then you will be able to understand the news. So adolescent, even a healthy adult, they are having all these issues that some the negative news will come and that will create a panic. And that's why one of my parents, whom I am just making a videos, YouTube videos, where I talked about mucormycosis. People they said, "Sir, we didn't start the video because we were afraid that if you say something very, that will make us tense." So we didn't see. I told them just you should have seen that video. I just explained what are the facts. So no need. Suppose third wave we are talking yet it might come, but it is not going to kill all of us or all of our children are going to get infected. So this is what positive thinking is important. Dr. Narayan, please.
Yeah, I just want to mention, at least try to spend, time with children, one on time, one to one directly with the children. And we also encourage, during the difficult time, at least have at least one meal, either breakfast, dinner, with the child, spending, having a family together. So if children have any issues, they will at least open up, and don't pretend that you are super busy all the time. Of course, everybody has a job to do, and we have to manage our job well. But at the same time, as a responsible parent, it's also important we give attention to our child and try to understand what is the need. And there are some weekends, where you can connect with they can connect with the grandparents. You can have a joint call. And we are not saying completely stop talking to people. Physical distance we have to maintain, but not necessarily avoiding all social interactions. So we also encourage if boy or a girl would like to talk to their friends in the classmates, please encourage. They are missing their friends, they are missing their teacher. And it's okay to have a call and, but basically keep a watch, listen to their needs, and their needs will be very simple. But if you don't listen, they will aggravate and they may take decisions themselves without consulting you. Don't get into that situation. Help them to solve the problems which are small. And then as a mother or father, I know how to handle and how to make your child happy. But do give time in between your busy schedule. That will help.
Right. 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 So we have quick 2-3 questions. So before ending, can we take these questions from the live audience?
Yes, please.
2 questions are common, like how do we keep teenagers away from screen, as it is a very tough task, and please share some tips for this age group, that how can we make them use their time productively, especially teenagers.
See, usually it is for teenager when you are dealing, it's a totally different ball game. We know that we have to be very, warm. We should be having a nurturing approach. We should be having a supportive approach, and we should make the atmosphere fun-filled rather than tense. So when you are talking to them, don't advise them anything. Rather than make yourself party with them and then tell us, is it okay to do this? Isn't it a good idea to do this? And most important thing is they will follow you. So whatever you are doing, see, if I am using the mobile all the time, if I tell my daughter to do that, she will not accept it. So rather than saying we have to do it, and that's the only thing we can, talk to them. Second thing, adolescent age group. See, there are children who are in 9th, 10th, 11th standard. They are having so much of pressure of study and so much of uncertainty about the exams, results, and their future. And they are not going to the class, so they are not able to express themselves, and parents are always putting a pressure that you should learn, you should be studying and all that time, and they are not able to perform. So then they are getting a depression. There are many who are getting depression. There is a suicidal tendency also. So you have to take care of, keep talking to your adolescent kids, because talking will definitely make them open up. And always try to become a friend of your son or daughter rather than parents. Unless you put yourself into their own shoes, you are not able to manage them. So this is very important. This is not just as a pediatrician I'm talking, I'm just talking as a father.
Right, right. And we have Nandini who's asking, how do I convince my 11-year-old daughter that not to go out to play during COVID times?
Now, 11 years old daughter, she can understand. We don't want to make her panicky also. Ask them to show the reality that these are the things which are happening. And scientifically, many a times I explain them scientifically. Just talk to them that as if they are students of science. Then let them understand. They will, understand it better. See, this is a virus, right? Virus will go into the body, and we know that some of the person has got infection, they got hospitalized. So, and as Dr. Narayan said, we are not able to see them. These are our enemies, particularly. Yeah, we are not able to see them. So we have to consider that always we are surrounded by the enemies. So that way you can explain them, and then you can make them understand. Yeah, you can go to play, but take care of yourself. Dr. Narayan can add something. He's master
Yeah,
in this kind
I
of
just
thing.
want. Not really after you, but what I want to say, there are many smart people. I always wonder, many people turn around this COVID situation into opportunity. Many people learned cooking, many people started singing very well, and some people do online dance classes one day, and they dance remaining 6 days themselves with the music. So it's important to engage children in activities which actually makes them happy, and you also want to see them dancing, singing. Indoor games, no problem at all, and outdoor you assess the risk, as I mentioned earlier. But many household activity, even keeping the house organized, keeping the house, kitchen work, they can help. And when the mother child, father child spend time in kitchen or household activity, it's actually doing things together, co-creating something. It's all for family. Those times are very precious, and we need to plan things. It will not have. It will not happen automatically, because all of us have our own workload and our own stress level. But doesn't matter. If you can just try to distress for some time, being with them, guiding them, they will say. And when they grow up, my childhood, this was the best time of my entire life. Thanks to my parents.
Right,
Then we
right.
will be kind of successful parents. I think we should try that.
Correct.
True, true. In fact, sir, we have divided time, and me and my kids do aerobic workout together in the morning, and in the evening they go out with their dad for cycling. So this is something which we are, doing continuously with them, so that it happens very well. Sir, one last question.
Similarly,
We have Mr. Gautam
my
here.
just a minute. My 13 years old daughter, she
Hmm.
cooks. Not only she cooks, she makes a roti also. So that is what
Right.
she has learned. So for 1 hour,
Hmm.
that 1 hour goes with that in cooking. So if the person is
Right.
what Dr. Naran said, dancing, cooking, whatever the hobbies, just try to cultivate. And that particular adolescent group, you have to divert them in a proper fashion.
True, true, true. Absolutely right. We have Mr. Gautam here who has some doubts related to the wave and all, and he's saying that my question to both the experts, that in first wave of COVID-19, experts said that corona won't affect much to children. Then why experts predicting or assuming that this time COVID virus will hit children? What about your views on this?
So these are not expert views, these are the speculations as we discussed. Because in first wave, there definitely number of the children were no less affected, and there are reasons for not getting affected because most important thing is this coronavirus gets attached to AC receptors in our respiratory tract. That receptors are less in children. They are not getting much infection as well as much complication like pneumonia. Now, in second wave, because most importantly, the variant was such that it was highly infective. So when it was in one family member of the family member of 10, almost 8 or 9 were infected. So because of the more infectivity, children are part of the family. That's why they got infected. The numbers were not high. It was at par with adults. But we didn't see the first, and the cohort is huge. And that's why we are seeing that we are telling it's a more number. Now, third wave, we are not telling, we are not predicting, nobody is telling, just we want to take care that even if it happens, we should be prepared. So even if the infection comes to the whole, unless the mutation occurs and it affects many people, then children will be part of it. Otherwise, children will not be that much affected, and even if it is affected, they will be mildly symptomatic. They can be managed at home just like this, what we had it. But we have to take care, because even a simple fever for one day will compel you to take the child to the hospital, and that is what we don't want. That's the ultimate reason behind making the things prepared.
Right, absolutely right, absolutely right. We just have to be aware that things doesn't become worse in the coming days, and we have to take care. Sir, now a quick request to both of you to give that final message to all the parents watching us right now. Starting with Dr. Narayan.
Yeah, thank you very much. It was very nice to meet all our friends, virtually. Actually, we as public health professionals, as development partners, supporting the government, and government is actually stepping up all the measures. Even today, I had a meeting with the government. I would like to tell you, government is doing their level best. We have a Government of India guidelines from Ministry of Health and Family Welfare how to manage COVID among children, if at all, we experience more cases. We have put systems in place for capacity building of frontline workers. We have put hospital preparedness plans in place in many parts, and lot of work is progressing. There is a plan for being prepared for getting essential equipments, additional number, oxygen. Government will do everything possible. Similarly, Chetan Bhai and team, I know Indian Academy of Pediatrics, Indian Medical Council, private sector, they are trying their level best. So when we do as a service providers our level best, we request you to do your level best by following all COVID appropriate behaviors, avoiding all super spreader events, keeping your children safe, taking care of all the elderly and everybody in the family, and advocating for COVID vaccination at the earliest possible time for everybody who needs it. And my last message, be mindful. Corona will not come to your house itself. Somebody has to bring corona inside. This can be a plumber, this can be an electrician, this can be a maid, this can be a driver, this can be a visitor, this can be anybody who is coming to your house. So please take care of those things, not to increase risk for yourself and your children. Continue to practice COVID appropriate behavior. So together with parents and community and government and service providers, we can end corona, but let us not be complacent. Let us be vigilant and not lower our guard till we end COVID pandemic. And take care of your children, and wish you all the best.
Thank you so much, sir. Yes, Dr. Chetan, your message to the parents?
Yeah, as a pediatrician, I must say that yes, you are concerned about your children's health. So first, if you want to protect your kids, you should get yourself protected. And for that matter, only things which are working, we all know that since 1.5 years talking, SMSV, social distancing, masking, sanitization, and vaccination. And COVID appropriate behavior, never ever let our guard down, because we have definitely burnt our fingers. We don't want to see this kind of atmosphere again. Please, government is going to do everything. This the all whoever people like in administration, they are working hard. But at least we should, at least they are expecting something we should do to protect ourselves. So that is our responsibility. That is a way we can cooperate to the government and all these people who are working for us. So just take care of yourself and save yourself as well as your children from this COVID. COVID will go. It is going to go. How we send them a COVID, that is important. So be positive, think positive, have a healthy behavior, good sleep, healthy food, and relaxed mind. Thank you so much.
Thank you so much, sir. Thank you to both the experts, from all the viewers, all the parents, and everyone at Multitasking Mommies. Thank you so much for taking out time from your busy schedules and enlightening us today. We feel much relieved after your talk, and we are definitely in this together, and we'll be coming out of this stronger, as you said, taking care of the COVID appropriate behavior and these tips, which were very useful. So a big thank you to both of you for giving us your time and this wonderful knowledge to us. Thank you so much, sir. With this, we'll be ending the session now.
Yeah. Thank you so
Thank
much.
you.
It was
Stay
a
safe.
wonderful attempt to make the people aware. And thank you for making us part of it. Thank you.
Thank you so much, sir. Thank you.
Thank you so much.
Thank you. With this, we end our session. We'll be back with such informative sessions again here on our Facebook page. Thank you so much for joining us today. And we end the session. Stay home, stay safe, and take good care of yourself and your family. Thank you so much. Goodbye.